Worried that you'll spend thousands on your hearing aids and hate them? Well, let's talk about that today. Hi, I'm Dr. Nancy Duncan with Duncan Hearing Healthcare, and that's one of the questions I get often because purchasing and investing in hearing devices can be a scary process. So we want to clear that up today and help you understand what to expect. Here's what we want to do if that occurs and you end up hating your hearing aids. First, we want to discover, why do you hate them? What's the problem, and can we find a solution? Understanding the why is the first step in help getting clarity on what can be fixed. Here are some common issues we run into. Sound quality issues. Hearing devices at first, to anybody who gets used to them, can sound tinny or harsh, sharp, louder than they expect, and often they feel like this is way too loud because guess what? Your brain hasn't heard normally in several years, so it does take some time to get used to, just like when you're trying to get used to bifocals. Things will seem off for a few days until your brain and your eyes come together. Hearing is very similar. Your ears need to get used to the changes. But the good news is we can ease you into that, and that's what you need to have happen to help get you acclimated as soon as possible. Another problem you can experience is fit or discomfort. And let's face it, we're not born with something in our ears, so it does take some time to get used to having a device in your ears, plugging up the sound. Things might seem hollow or harsh at first, or your voice might seem echoey. All very normal in the beginning, but it does take some getting used to. However, if your hearing devices cause discomfort or pain, that's not normal, and that's something that needs to be addressed right away. You should never experience pain or discomfort while wearing hearing devices. Another common complaint we get in the beginning is background noise can be overwhelming. Keep in mind, you've been in a quiet world. You haven't had to use your ears to hear and decipher sound versus background noise because everything's just been a jumble of noise. Now we have to help get you used to picking out the things that you want to hear while phasing out the things you don't, such as background noise. And that's a process where practice makes perfect. So time and consistency of use are going to be your best combatants to get used to these things. You may find in the beginning that hearing devices feel useless. Discuss that with your practitioner. That could be something as simple as you're ready for more amplification to get you one step closer to your prescription. So always be open and honest with your experiences so they can help you. And many patients experience frustration with getting used to changing a battery, opening battery doors at night. The good news is with the new technology, you have many rechargeable options. So this takes that away and keeps that problem from being a problem, basically. Other frustrations would just be with high tech. Many people aren't used to or ready to adopt high technology hearing devices, but the more open you are to that, the better your experience will be. Hearing devices these days can stream music, phone calls, allow you to adjust them with a smartphone, and even have a Find My Hearing Device app that can help you find them in the event of loss because, hey, we're all human. These things happen. So always be open to the technology that's available to you. You might be surprised at how well and quickly you can learn it. The other thing is to keep in mind with any hearing device, you get an introductory trial period to make sure they're going to work for you. During this time, I encourage my patients to jot down any problems or concerns they have, and throughout the process, because oftentimes we'll look at it as the professional and discover that one adjustment could take care of all of these problems. The more information that you can provide, the better your experience will be with your hearing devices. So if you're experiencing any of these problems, the first thing you'll want to do is talk to your audiologist or hearing care practitioner. Being open and honest about what mistakes you're having will give them an opportunity to fix it. Sometimes a few tweaks and adjustments on the computer is all you might need to change your experience entirely. If it's a fit or discomfort problem, also discuss this. Sometimes they can buff down certain areas of the hearing device to make it fit more comfortably, or have it remade by the manufacturer if necessary. This would be at no cost to you as the hearing devices are under a warranty with that manufacturer. The other thing they can do if there's a fit problem is to change domes or earpieces because often there's a piece that goes in your ear while there's a piece that goes on top of the ear. The interior portion is an easy fix and something we can often just change right in the office and change that quickly and effectively so you'll be right on your way to happy hearing. And because of that trial period I mentioned, you can sometimes switch manufacturers completely. So if the algorithm that is producing the sound with that particular device is not right for you, we can switch to a different manufacturer that might make a world of difference. So always keep an open mind throughout the process because one route may not be a great experience, but changing one or two things can change everything for you. And the one thing to remember is don't tough it out in silence. There's no reason to do that. If we don't know the problem as your practitioner, we can't help fix it. So being open, honest, and sharing all of your experience can make a difference. Even if you feel it might be silly or nonsensical, often it makes sense to us. We've heard it all, trust me. And don't be afraid to take advantage of that trial period. Most practices offer between 30 to 60 days to give you time to acclimate to the hearing aids, but also to give us time to adjust and solve any of the problems you may encounter. And so that way it's a win-win at the end when you're doing well and hearing as well as you can. And for that trial period, most practices offer a full or partial refund at the end if you just find this isn't right for you and you're just not ready. You can return the devices and often get your money back, as I mentioned, in full or at least in large part. Truly gives you the ability to test drive those devices before it's set in stone that they're yours to keep. It's also important to remember to give your brain time to adjust. Our brains don't like change. That's how we're wired as humans. And so sometimes it needs a little bit of time and practice to nudge it in the right direction to help get you on the pathway towards better hearing. Once you get there, you'll notice a huge difference, and you might find that when you take them out, you feel that you're not hearing anything. It's because now you've realized how much better you can and should be hearing. Keeping in mind that hearing aids are amplifying sounds that you haven't heard in years. This can be jarring and shocking in some cases. So please be patient with yourself and give yourself time to adjust. Take it slow and introduce sounds gradually, because the more you are out and about in loud sounds too soon, it can be overwhelming. So take it slow. It's been a while since you've heard those things. You're going to need time. Lastly, if you've tried all these things and nothing is getting better, don't hesitate to seek a second opinion. Not every practitioner is a right fit for you. So keep an open mind. Don't give up on your hearing, because it's important to get back out there in the world and hear everything the world has to offer you. And if you find that traditional prescription hearing devices aren't working for you, don't hesitate to ask about over-the-counter devices. These are widely available and may even be available from your audiologist or hearing care practitioner. Some other options may be specialty devices that are ready and available for specialty hearing losses. For example, if you have single-sided deafness, or you have hearing loss in both ears, but one ear is so bad that it cannot help you, there's something called a cross or a bi-cross option that can take sound from the bad ear, transfer it to the good ear, and give you a better outcome. So again, always express your concerns. There might be a solution out there that you're just unaware of. The other thing to be open-minded to are the assisted listening devices that are available. It can be something as simple as a clip that a person wears that their voice gets sent to your ears so you can hear them better. You could have a television streamer, so the sound of the TV will come right to your ears so you could watch with someone else at 2 different volumes but enjoy the same program together. That alone has saved many marriages, as you can imagine. Some of these devices can work independently or in conjunction with your hearing devices. So again, ask about these things. It can really make a world of difference. So hating your hearing aids isn't the end of the process. It's often just the beginning. Make sure you talk to your audiologist about the problems you're having. Be patient, keep an open mind, and you may at the end be very surprised at how far you've come and how much your world has changed. So if you're struggling with your devices or you just outright hate them, let's chat. Give me a call today. I'd be happy to consult with you to see if there's anything additional that can be done to help give you the best possible outcome. There are more options than you think, and we don't want you to suffer in silence. So again, I'm Dr. Nancy Duncan with Duncan Hearing Healthcare, here to help you improve your hearing journey. And if you've liked what you heard today, like and subscribe today.